hope at this point in time that you've considered stretching and strengthening to help improve your lumbar spinal stenosis. And as you should, if you talk to anybody, your doctor, your PT, or even look online, stretching and strengthening is a part of a healthy program for spinal stenosis. But what's different about spinal stenosis is that if you only stretch, you're going to be missing out on the strength component to support your spine with standing and walking. And if you only strengthen, you're definitely not giving your nerves and your back that room to breathe. Well, when I work with my clients, we know that we should be doing both, but today I'm going over the exact proportion of each in the 70-30 rule that I use with my clients who are struggling with standing and walking. They have spinal stenosis. They know they should be stretching and strengthening, but they don't know exactly how to go about it. So today we're going over that exact how in the 70-30 rule that I use with my clients. So when I start treating my patient and they have spinal stenosis, we go right into this rule, the 70-30 rule.
They are going to be doing 70% stretching and mobility work and 30%
strengthening. And so when you have spinal stenosis, it's important to realize that you have a space issue. And to improve that space, you do things such as stretching. Stretching and mobility work to your hips and spine. And those are going to be done every single day, if not more than once a day. So they're doing that every single day and then strengthening about every other day. So you're doing a lot more stretching than you are strengthening. Multiple stretching exercises and maybe 1 or 2 strengthening exercises. A lot of times with my clients, they have strength. They have some built-in strength. Yeah, they need to do some targeted strengthening, in which we'll do with their program, but they don't need to be doing a lot to have a significant improvement in pain, which is amazing news. But what they miss is they're not stretching enough. They're not doing mobility work enough. They're not giving their nerves enough room to breathe. And that is so important. So the 70% stretching and mobility work will help reduce pain. The 30% strengthening work will give them that little nudge to improve things such as standing and walking. And if you're having any issues with standing and walking, check the description. I came out with this great ebook that goes over how to improve standing and walking specifically for lumbar spinal stenosis. It's going to be laid out for you, multiple weeks of progression, so make sure you check that out. But when I'm working with clients, we're starting off with these few exercises that I'm going to show you here in just a second to help improve nerve health and mobility. And so giving those nerves some room to breathe, and then strengthen your spine and hips to give you that support you need for walking. So you can't strengthen your way out of pain with stenosis, but you can do a combination of nerve health and mobility work, which we're going to be going over, and strengthening to give you that endurance that you need for walking. So let's go over the example workout that I would give a client that's going to be that 70-30 split. So here's the 70%, the stretching and mobility work. And you remember me just saying the nerve health. So we're going to be going over spine, hip health, and nerve health with this simple stretch, but there's going to be some variations. And I'm all about something that's convenient and effective. And so I love standing stretches because you don't have to get on the ground. No one likes getting on the ground. So you're going to grab a bench or a chair, something that you feel safe standing next to and putting your foot on. Oftentimes my patients will use a chair. They'll have the back of the chair that they hold onto and then put their foot up on the seat of the chair. But for me, I'm going to use a bench. I have the bars here to help me out. Now, you're going to be doing this on both legs, but definitely the leg that you have the most problem with. So if, let's say, you're standing and walking and pain goes down the right leg, you're absolutely going to do this on the right. But most of my clients love the way that this feels, so they do it on both sides. You're going to be straightening that leg. We're going to go into the hamstring stretch, which is the first part of this. That hamstring stretch, which means you're going to keep that toe pointed down. You're going to round your back, hold on to something sturdy, go down and hold the stretch for 1 second. Come back up, bend the knee, and then shift forward. So in this part of the stretch, my hip stretches, and in this part of the stretch, my hamstring stretches. Guess what this is called? Hip flexor to hamstring stretch. 1 second hold of each. You're going to be doing knee bend, knee straight, 20 repetitions on each side. Ooh, this is the 70%, right? You're going to be doing this at least once a day. I've got patients who do this 3 times a day. I've got patients who do this first thing in the morning because they love the way that it feels. And then I have patients who just do this before they have to stand and walk, which is completely fine depending on where you are with the recovery. So you're going to be doing the hip flexor stretch here and the hamstring, 20 repetitions here. So 10 to this way, 10 to this way. I think we're almost done with the side. Now this is the first part of this stretch, which is for hip flexor and hamstring, right? That's hip and spine mobility, which is related to muscles and joints, okay? Now, in just a second here, I'm gonna switch legs, because now I feel nice and loose. I'm gonna go the other leg up, Same exact form. We're gonna shift forward, get that hip flexor stretch. But now when this leg is back, I'm gonna do a little adjustment. I'm gonna get a little tall and then pull that foot up and down. Pull that foot up and point the foot down. That's what I mean, okay? So pull the foot up, that's 1 rep, point it down. Pull the foot up, 2 reps, you're gonna do 20 reps there, and when you pull it up with that leg completely straight, that's a nerve stretch, people. That is absolute nerve mobility. We need nerve mobility and health to tolerate standing and walking when you have stenosis, because stenosis is a space issue, and a lot of times people don't have like true issues with stenosis until they start having nerve pain with stenosis. And that nerve pain is when you stand and walk and you start to have a building of back and leg pain. So as you stand and walk longer, that pain increases longer or into more intensity. So point that foot up or pull that foot up, point that toe down, pull up, point down. 20 repetitions there, enjoy that nerve pull. Now, I'm gonna be honest with you. If it sucks, it means you're doing it right. Nerve pulling and stretching does not feel like muscle stretching. It kind of feels worse for a second, but then when you bend that leg and you relax, it goes away. It feels really, really good. So I'm gonna go to the other leg just because I wanna give a little nerve health to both of my legs here. So nice and tall, you're gonna pull up, point down, pull up, point down. You can feel it anywhere in your calf, hamstring, or back or glute when you pull up. It's crazy, I know, it's absolutely wild. Remember, your hamstring doesn't go down to your foot, right? So when you manipulate the foot and you have symptoms, that's not from your hamstring, that's from a nerve, okay? So you're gonna be going up, down, 20 repetitions. And as I notice, as I continue to do it, I feel better and better. Like I just feel looser. So we did hip health, which is related to spine health with the hamstring and hip flexor stretch. And now we're doing the nerve glide or sciatic nerve stretch to help improve that nerve mobility when you stand and walk. So there's 2 variations, right? So you've got your hip flexor, oh, losing my balance, hamstring. Now pull the toes up, point down, nerve glide. And over time, as you get better doing it, it's gonna become more fluid. But in the beginning, I really want you to focus on the difference in feeling. You should feel muscle stretch and nerve stretch. And when working with stenosis and improving our standing and walking ability and improving our back pain and leg pain, you have to work on all of those. You can't skip any of those steps. That's why you spend 70% of your time stretching and doing mobility work and only 30% of your time doing strengthening, which is every other day, which I'm gonna go over a couple strengthening exercises here in just a second. But if you don't understand those nerve glides or you're not feeling it, ask the question underneath the video, right? It's important to get that answered, and everybody's body is kind of different, but I promise you I can give you a little bit of information so you can feel it. For example, if you consider yourself super flexible, you may have to bend over really far before you feel that glide. But that's not me, and that's not most people. And so don't be afraid to add a couple variables or change positions so you can feel that nerve stretch. Now let's get into the strengthening, the 30% of the home program that you're going to have after you do your mobility and stretching. And in nerve health, you're gonna follow it up with some strengthening, but only 3 days a week. Now it's time to go over that 30%. And so I haven't found a better way to strengthen with stenosis, especially in the very beginning, than using a suspension trainer. And I'll put a link in the description, but what this allows you to do is just worry about the strength and not have to worry about losing your balance or your form. It allows you to have just really clean form when you have spinal stenosis. It's so important. So I like using the suspension trainer. I think it's like 30 bucks or so. It's in the description. Pick one up if you don't have it. It's very useful. And if you've seen my other information, such in my book or other resources I have, you'll know that I really enjoy this. So it's very effective. Just try it out. And if you don't have one, go to a gym or something. Like a lot of places have it. So it's called a suspension trainer. You don't need a particular brand or anything. Now these 2 exercises are great, and remember we're only doing these every other day. About 30% of your time is spent on strengthening, and when I work with my clients, they want to improve leg strength, they want to improve pain and posture, so we're going over all of those. My very favorite exercise to do with this first is the lunge, and so what you're going to do is keep the handles pretty close to your chest, giant step back. Now this should looks like walking, right? This is how we improve our standing and walking ability. We're gonna go into nice tall posture and bend both those legs. Now what this allows is if I start to lose my balance, I can stay upright. We're gonna be doing 12 reps on each side, a nice easy strengthening exercise for spinal stenosis. And what you'll notice is I don't care what stage of life you're in, I don't care what replacements you've had, you'll feel the burn, you'll feel your legs and hips working. This bad boy works, okay? So if you're doing this every other day, if you want to try this for a couple weeks or so, then I would be doing 2 sets of 12 to start off with, progressing your way up to 2 sets of 20, and then progressing your way up to 3 sets of 20. And that's going to absolutely give you that glute and leg and lower back strength that you need for walking. Whew. It's great. It's absolutely great. So every other day, you're doing your lunges, a couple sets of 12 on each side. You're going to follow it up with a row. This is the posture exercise. Nice and tall. You're going to trust this suspension trainer. It's not going anywhere. Nice and tall. Extend the arms. Row up. Nice and tall. Extend and row up. See my posture here? Slow and controlled. Lower back, upper back posture muscles supporting us when we stand and walk, which are hard to do when you have spinal stenosis. Couple sets of 12 to start. Couple weeks of doing that, then progress up to a couple sets of 20, then progress up to 3 sets of 20. I know it sounds a lot, but it's easy to build that strength over time. So do 12 repetitions here. You'll take a 1-minute break, and then you'll do 12 more repetitions. Ooh. And the row exercise is so clean and you just get so much confidence when you do it because it improves your arm strength, it gets your upper back going. And if your back starts to get sore, there's nothing wrong with going right into that hip flexor to hamstring stretch or nerve glide to help relieve. So you're going to do the hip mobility, nerve glide, followed it up with the strengthening, finish off with the hip and mobility work, and that's just going to make you feel good. Every single day of doing the mobility and nerve glides, every other day of doing the strengthening, and you're going to notice some improvement, but that proportion allows your body to grow in the areas it needs to grow in regards to strength. That's enough to improve strength. But then give your nerves that little bit of room to breathe. Give your spine that little bit of room to breathe. And so the hip flexor and hamstring mobility work with the nerve glide, followed up with the strengthening using the suspension trainer to help us focus on strength rather than balance. And all of those things are going to improve your pain and mobility. Now, if you specifically have problems with walking, those are going to help with walking, but there's some more I go over in the ebook and in my revision sciatica book, which has a very specific portion on spinal stenosis that's going to allow you to give you that edge to make sure that we're approaching everything that we need to do to improve standing and walking. But today we went over the exact proportion that I use with my clients. If they're approaching me with spinal stenosis, they know they need to stretch, they know they need to strengthen, but I hope today gives you a little bit of an idea of how to structure your home program. So feel free to use these exercises, feel free to use some other exercises, but spend just a little bit more time doing stretching and mobility work and a little less time strengthening, and I bet you'll notice an improvement in pain, strength, and function. But as always, guys, stay healthy, keep moving, and take care of yourself.